Have you ever wondered what's worse than the blurriness of cataracts clouding your vision? Imagine a condition that doesn't just blur, but progressively takes away the very center of your sight, leaving you in a world of shadows and uncertainty. This is the reality for those facing age-related macular degeneration, AMD, a condition deemed far more severe and challenging to treat than cataracts. With over 196 million people worldwide grappling with AMD by 2020, and projections soaring to 288 million by 2040, this stealthy vision thief is not just common. It's a growing epidemic. According to the American Macular Degeneration Foundation, age-related macular degeneration is the leading cause of vision loss, affecting more than 10 million Americans, surpassing cataract and glaucoma combined. Unlike cataracts, which can be relatively easily corrected with surgery, AMD treatment is complex, ongoing, and, in many cases, only slows progression rather than curing the disease. So, what makes AMD the lesser-known yet more feared adversary in eye health? Let's dive into the world of this vision predator, understanding its symptoms, treatments, and why it's crucial to spot it before it dims the vibrant details of life. Hi, I am V and welcome to the best health channel on YouTube where we talk about everything related to your health and well-being. In today's video, we're going deep into the world of age-related macular degeneration, a condition that can significantly alter the way you see the world, literally. I will be arming you with all the necessary information to identify the symptoms of AMD, understand the available treatments, and be aware of the causes and risk factors that contribute to its development. Knowing these can be your best defense against this vision-threatening condition. But that's not all. We'll also compare AMD's effects with those of cataracts, giving you a clear picture of why AMD requires our attention and proactive care. With the right knowledge, you can take steps to protect your vision or that of someone you love. So, if you're ready to safeguard your sight and learn more about this prevalent yet often misunderstood condition, make sure to hit that like button, subscribe to our channel for more insightful health content, and ring the bell to stay updated on all our latest videos. Let's dive in and uncover the truth about age-related macular degeneration together. Now that we've set the stage on why age-related macular degeneration, or AMD, deserves our undivided attention, let's get into what exactly AMD is and how it stands apart from cataracts. At its core, AMD is an eye condition that gradually destroys central vision. This happens because of damage to the macula, a small spot near the center of the retina that's responsible for sharp, straight-ahead vision. Imagine the macula as the camera's most critical focusing area, essential for reading, driving, and recognizing faces. Now, when AMD comes into play, it's like having a smudge on the most crucial part of your lens, progressively blurring and distorting your central vision. Contrast this with cataracts, which are more like a foggy window that clouds the entire lens of the eye, affecting all aspects of vision, but often uniformly and sometimes more reversibly. While cataracts can be quite disruptive, they don't typically lead to the level of central vision loss seen with AMD. And here's a hopeful note. Cataract surgery can often restore vision lost to the clouding. But with AMD, we're dealing with a different beast. There's no cure, and treatments aim to slow progression and manage symptoms rather than restore lost vision. Understanding these differences underscores the importance of early detection and management of AMD. It's a condition that sneaks up on you, affecting your ability to do the things you love and maintain your independence. Moving on, let's unravel the mystery behind what causes age-related macular degeneration and who is at the highest risk. Understanding these can give us insight into how we might prevent or delay its onset. Firstly, the exact cause of AMD isn't pinpointed to one single source. It's a complex interplay of genetic, environmental, and lifestyle factors. However, we do know that aging plays a significant role, hence the age-related in its name. As we age, the tissues in our eyes, particularly the macula, naturally deteriorate, which can lead to AMD. Now, on to the risk factors. Some of these are out of our hands, but knowing about them can help us stay vigilant. Age is the biggest risk factor. Individuals over 60 are at a higher risk, though AMD can occur earlier. Genetics also play a role. If you have a family history of AMD, your risk increases. Race is another factor. Caucasians are more likely to develop AMD than people of other races. Smoking significantly increases the risk. Smokers are up to 4 times more likely to develop AMD compared to non-smokers. Obesity and diet can influence your risk. High-fat diets and obesity can increase the chances of developing AMD. High blood pressure and cholesterol are also linked to a higher risk of AMD. Sun exposure can damage the eyes over time, and prolonged exposure to UV rays is believed to contribute to the risk of AMD. Understanding these risk factors highlights the importance of a healthy lifestyle and regular eye checkups, especially as we age. While we can't change our age, race, or genetics, we can certainly address smoking, diet, and sun protection to help protect our precious vision from AMD. Remember, knowledge is power. By being aware of these risk factors and taking proactive steps, we can help safeguard our eyes against the challenges posed by age-related macular degeneration. Knowing the signs of age-related macular degeneration, AMD, is like having a map in a dense forest. It can guide you through the confusing landscape of eye conditions and help you seek timely help. Let's explore 11 key symptoms of AMD, painting a clear picture of how these symptoms stand apart from those you'd experience with cataracts. Blurred vision. Unlike the overall foggy vision with cataracts, AMD causes your central vision to blur, leaving the peripheral vision intact. It's as if the center of your visual field has been smeared with Vaseline. Dark, empty areas are blind spots. As AMD progresses, you might notice dark or blank spots blocking your central vision. Cataracts, on the other hand, generally affect the clarity of your vision but don't lead to black spots. Distorted vision. Straight lines start to appear wavy or bent with AMD, a symptom not associated with cataracts. It's like looking through a funhouse mirror where everything seems distorted. Difficulty adapting to low light levels. People with AMD may find it increasingly difficult to adjust to lower light levels, which isn't a hallmark symptom of cataracts. Decreased intensity or brightness of colors. AMD can wash out the vibrancy of colors, making them seem dull, while cataracts can cause a yellowing of your vision, affecting color perception differently. Increased difficulty with fine details. Activities requiring sharp vision, like reading or needlework, become challenging, more so than with the general vision impairment caused by cataracts. Visual hallucinations. In more advanced stages, some individuals with AMD experience Charles Bonnet syndrome, where they see complex visual hallucinations. This is not a symptom seen in cataract patients. Needing brighter light for reading or close tasks. As AMD affects your central vision, you might need more light than before to see details clearly, a symptom not directly tied to cataracts. Difficulty recognizing faces. Due to the loss of central vision, recognizing faces becomes a challenge, which is more specific to AMD. Impaired depth perception. AMD can affect your depth perception, making it difficult to navigate steps or curbs, a contrast to the overall blurred vision cataracts cause. Rapid vision loss. While both conditions can lead to a decline in vision, the loss associated with AMD can be more sudden and pronounced, particularly in its wet form. Recognizing the symptoms of AMD early can make all the difference. If this information resonates with you or you know someone it could help, please share this video. Spreading awareness is the first step towards prevention and management. And if you're learning something new, let us know by hitting that like button and subscribing. As we navigate through the challenges of age-related macular degeneration, AMD, it's crucial to understand the beacon of hope that treatment options offer. Though AMD can be a formidable adversary in our quest for maintaining clear vision, modern medicine has armed us with a variety of tools to combat its progression. Here are the primary treatment avenues. Anti-VEGF injections. These are the frontline warriors against wet AMD. Medications like Lucentis, Eylea, and Avastin are injected directly into the eye to halt the growth of abnormal blood vessels and reduce fluid leakage, which can help stabilize or improve vision. Laser therapy. For certain cases of wet AMD, laser therapy can be used to destroy actively growing abnormal blood vessels beneath the retina. This approach aims to prevent further damage but is less commonly used today due to the effectiveness of anti-VEGF treatments. Photodynamic therapy, PDT. This involves injecting a drug into the bloodstream that gets absorbed by the abnormal blood vessels in the eye. The eye is then exposed to a laser that activates the drug, destroying the vessels without damaging the surrounding tissue. Vitamins and supplements. The AREDS, Age-Related Eye Disease Study, and its successor, AREDS2, have shown that certain combinations of vitamins and minerals can slow the progression of AMD in its intermediate stage. Supplements containing antioxidants, zinc, and copper, along with lutein and zeaxanthin, are recommended for those at high risk or with early AMD. Low vision rehabilitation. While not a treatment for the disease itself, rehabilitation can help those with AMD maximize their remaining vision and maintain quality of life. Techniques and tools like magnifying devices and specialized glasses can make daily tasks more manageable. Lifestyle changes. Incorporating a diet rich in leafy greens, fish, and nuts can support eye health. Regular exercise and quitting smoking can also reduce the risk of progression. Emerging treatments. The field of AMD treatment is rapidly evolving, with new therapies such as gene therapy and stem cell therapy being explored in clinical trials. These offer hope for future breakthroughs in AMD management. Navigating AMD treatment options is like assembling a puzzle. Each piece plays a crucial role in the overall picture of managing this condition. It's essential to work closely with an eye care professional who can guide the selection of the most appropriate treatments based on the type and severity of AMD. Got questions or insights about AMD? We'd love to hear from you in the comments below. Your feedback not only enriches our community but also helps others feel seen and supported. Let's create a space where we can learn and grow together. And if you're finding our content helpful, a quick like and subscribe goes a long way. As we come to the close of our journey through the complex landscape of age-related macular degeneration, AMD, it's clear that while AMD presents a significant challenge to our vision, the path forward is illuminated with knowledge and advanced treatment options. Today, we've delved into the symptoms that distinguish AMD from other eye conditions like cataracts, highlighted the importance of understanding its causes and risk factors, and explored the arsenal of treatments available to combat its progression. Remember, knowledge is power. Recognizing the early signs of AMD and taking proactive steps can make a substantial difference in managing this condition. Embracing healthy lifestyle choices, staying informed about the latest advancements in eye care, and maintaining regular checkups with an eye care professional can help preserve your vision and quality of life. We encourage you to share this video with friends and family, spreading the word about the importance of eye health and AMD awareness. Together, we can face AMD with courage and optimism, equipped with the tools and knowledge to tackle this condition head-on. Thank you for joining us in this important discussion. Don't forget to like, subscribe, and hit the bell icon to stay updated on more content that empowers you with health knowledge. Here's to clear vision and a brighter future for all.